Hello and welcome. If you're a parent or a caregiver for a child with developmental needs, I just want to start by saying what you do every day is a huge deal. Seriously, trying to manage all the appointments, the therapies, and a healthcare system that is, let's face it, not always easy to figure out, it can be totally overwhelming. So this explainer is for you. It's all about giving you some clarity and, more importantly, some real tools you can use. So let's jump right into a situation that might feel, well, a little too familiar. Your child is finally making real progress in therapy. Could be speech, could be occupational therapy, you name it. Things are looking up. And then you get the call. And just like that, the provider you and your child have come to trust is now out of network. Your heart just sinks, right? You immediately get on the phone, but every single clinic you call tells you the same thing. There's a wait list. And it's not just a few weeks. We're talking months. You're stuck in this frustrating loop with no clear answers, and all you're thinking is, but my child needs this now. And let's be really clear here. This isn't just some small inconvenience. The stakes are incredibly high. When medically necessary therapy gets delayed, kids can actually lose the skills they've worked so hard to build. All that progress can just stall out, and honestly, daily life gets a lot harder for your child and for your whole family. Okay, so why? Why is this happening? Because it's not random, and it's not just bad luck. There are very specific reasons that families all across Georgia are hitting these roadblocks. And, understanding the why is really the first step to figuring out how to push back. So here's this story, basically in 3 parts. Back in 2024, Georgia's leaders actually did a good thing. They increased Medicaid funding specifically to make therapy easier for kids to get. Awesome, right? But then, one of the big Medicaid insurance plans, these are companies called Care Management Organizations, or CMOs, that Georgia pays to manage patient care. They turned around and slashed what they pay therapy providers by a whopping 20%. And that puts these clinics in a financial nightmare. And that's the pressure that you are feeling when you're just trying to get an appointment. Let's just break down what that 20% cut actually looks like in real money. It's pretty simple. Imagine an insurance plan used to pay a clinic $100 for a single therapy session. Now, for the clinic to actually provide that session, they have real costs, They've got to pay the therapist, pay the rent, pay their staff, keep the lights on. So when you add all that up, let's say their actual cost to provide that care is about $95. Okay, the margin is thin, but they can make it work. But now, after that 20% cut, the insurance plan is only paying $80 for that same exact service. The clinic's costs are still $95. Nothing's changed for them. So you tell me, if you're losing $15 on every single visit for a huge chunk of your patients, how is that clinic supposed to survive? They can't. They have to make really tough choices, like stop taking new patients, or cut back on their Medicaid clients, or, in the worst cases, just shut their doors completely. And that is how a decision made in a boardroom creates this massive crisis for families on the ground. It's the direct cause of those endless wait lists. And in some parts of Georgia, especially in more rural areas, it creates what are called therapy deserts. Entire counties where finding care becomes almost impossible. But, and this is a big but, here's where the story takes a turn. Because in the middle of all this frustration, you and your child have an incredibly powerful right on your side. It's a federal protection, and it's called EPSDT. And honestly, it's the most important tool you have. I know, it sounds like a bunch of government alphabet soup. But the idea behind it is actually really simple and really powerful. EPSDT is basically the heart of Medicaid law for kids. It guarantees that any child under 21 on Medicaid has a right to any and all health services that are medically necessary to help with their condition. The official language they use is correct or ameliorate. All that really means is that if a therapy can improve your child's condition or just keep it from getting worse, it's not optional. They have a legal right to it. And yes, that absolutely includes speech, occupational, and physical therapy. Let's just say that one more time, because if you take away one thing, let it be this. Your child has a right to medically necessary therapy, period. That's not a suggestion, it's the law. And that right comes with some really important rules. The law says services have to be provided with reasonable promptness. That means they can't make you wait for months and months. And here is the real kicker. An insurance plan cannot deny services just because they don't have enough providers in their network. If they can't find you someone in network, they are legally required to find and pay for someone out of network. That's huge. Okay, so knowing your rights is one thing, but turning those rights into action, that's the part that really matters. So if you're stuck in this gap right now, here is a clear 4-step action plan you can start today. Step 1, call your insurance plan and ask to be assigned a case manager. Then you ask them, point blank, what is your plan to make sure my child's therapy continues without any interruption? Step 2, and this is non-negotiable, document everything. Keep a log of every clinic you call, the date, who you spoke to, and exactly what they told you about their wait list. This log is your proof. Step 3, if you can't find an available provider in their network, it's time to escalate, formally. And step 4, ask your child's doctor or their current therapist for letters of medical necessity. This is the backup that makes your case rock solid. Now, when you escalate, you need to use these exact words. Write this down. I am requesting out-of-network authorization due to network inadequacy to prevent interruption of medically necessary services under EPSDT. See, this isn't just a complaint. This is a formal request that uses legal language. It puts them on notice that you know your child's rights, and it triggers their legal responsibility to act. Now, I know this can feel super intimidating. It's a lot to take on, but the most important thing to remember is that you absolutely do not have to do this by yourself. There are amazing organizations right here in Georgia whose whole job is to help families with these exact situations. Groups like Parent to Parent of Georgia and the Georgia Advocacy Office, these are the experts. They're the people you want in your corner. They can support you, help you understand all the fine print, and even guide you through the process if you need to file an appeal. Please, don't hesitate to reach out to them. I really want to end with this thought. When you're up against a giant healthcare system, it is so easy to feel small, to feel powerless. But I'm telling you, by understanding your child's rights and by taking these clear steps to advocate for them, you are incredibly powerful. So we'll just leave you with this final question to think about. When you make that call, when you use that specific phrase we talked about, you're doing so much more than just fighting for your child's future. You're sending a loud and clear message that the system has to do better. You're demanding accountability, and you're helping pave a better, easier path for every single family that comes after you.